Hi there, I'm Shawna Robins, founder and CEO of Spark Health. And today we are talking about building stress resilience with a positive mindset. It's an interview that I'm doing for Authority Magazine. And I have Dr. Shelby Harris with me today. She is a licensed clinical psychologist specializing in sleep disorders. She's a board certified expert in behavioral sleep medicine and author of a book on overcoming insomnia, The Woman's Guide to Overcoming Insomnia, Getting a Good Night's Sleep Without Relying on Medication. Dr. Harris is passionate about helping people improve their sleep quality through non-medical interventions, which I am a big, big fan of. Thanks for joining me today, Dr. Harris.
Thank you for having me. It's a pleasure being here.
Yeah, so let's first of all, before we dive into the whole sleep conversation, let's talk about stress. I know from experience, and I know from the women that I coach, that stress seems to be one of the largest elephants in the living room when it comes to impacting their sleep. So talk to me about, the definition that you feel of stress, anxiety, overwhelm, burnout. Like what's the range? What do you see? And what are your thoughts on that?
Well, given that I'm a clinical psychologist by training, so I see personally a lot of patients who have a lot of anxiety in general. So anxiety is not necessarily a bad thing. It's meant to light a fire under your behind to act on things. So it becomes problematic when it starts impacting your ability to live in your daily life. So sleep is one thing. So if it starts to impact routinely your sleep multiple nights a week, then we start talking about it being a problem, or it's getting in the way of you being able to do other things, focus on your work, be present with your family, whatever that is. And then burnout is a little bit different. So burnout is just like you might not recognize it happening in the moment, but it's extreme fatigue. It's an inability to focus on things that you need to do. But it's not necessarily, I mean, you can have overlap, but it's not necessarily that ruminative thought process that's always going on. Your body's just done. And your brain is just done when it's burnout. But like I said, you can have both those things going on. So I see so much of those things in my practice day in and day out. And I really try to focus on it as a piece of the sleep problem because people really do come to me mostly for sleep issues because that's what I'm known for. And it really does impact sleep for so many people, especially anxiety. Like so many people will go to bed at night and they're just not able to turn their brain off. It's just ruminating about anything and everything. And for some people, it's not even anxiety, it's just a busy brain. They just can't turn that brain off. So we work a lot on ways to quiet the brain, whether it's anxiety, not ways to relax the body, so that then hopefully you can set the stage for sleep better.
I like that. Okay, so can you share with us some of the things that you recommend? And I'm assuming when you say people, are you talking about men, women, what?
Anyone. I mean, I work with uh, everyone from babies through older adults. So it's like anyone really. But I mean, I do see a lot of women. I mean, because I'm known, like my book on women's insomnia. So I do a lot of that work, a lot of people in perimenopause, menopause. That's a huge issue that I've been treating for years. But really, I mean, I think the thing is when people are coming to me for insomnia work, what we're generally doing is cognitive behavior therapy for insomnia. So that's like you were saying, that's what my book is really on. So it could be things like CBT for insomnia is an evidence-based treatment that is short-term, generally 4 to 12 sessions, where we're really just focusing mostly on the sleep stuff. So it's not as much anxiety and depression. Now, if I have someone who has a lot more anxiety, depression, burnout stuff, then we'll work on that a bit more. But when it comes to CBT for insomnia, I mean, the basic sleep hygiene stuff is great. We always need to do that, limiting caffeine, limiting alcohol. But the reality is for people who are really suffering with their sleep problems, sleep hygiene is not going to touch these things. It's generally the control group for most studies on insomnia. So we're going to work on changing their bedtime, wake time. A lot of people, when they're feeling anxious or especially like depressed or even burned out, they're going to bed, either they're staying up too late, like zoning out on their phone, or they're getting in bed too early, trying to catch up on sleep. And then that ends up backfiring, or they're sleeping in or napping. Those are all things that can be a real issue for those patients. So we'll work on changing the timing of their sleep so that they're falling asleep faster, they're sleepier at night, and they're staying asleep more, or they wake up and then go back to sleep. So that's one piece of it, is like almost like limiting time in bed. It goes against common sense. And then other things that we would do would be what you're doing in bed at night. So are you doing things that are negatively impacting your ability to sleep? So are you sitting there and like doom scrolling on your phone when you wake up at night? I mean, right now, people are just really heightened because of the state of the world. Their anxiety levels are just and just stress is just up here. So they're looking at the news, they're looking at various like friends on social media, and that stuff is not going to necessarily help them. So it's a lot of like, what are you doing in bed at night? Can we get you out of bed? Let's find things to like quiet your brain a bit. Then other things we might do to help quiet the brain would be things that I do with anybody, whether it's insomnia or not. I'm a huge proponent of mindfulness meditation.
Mhm.
So when we think about it, people often use meditation. They'll use a lot of the apps, for example, they'll use them right at bedtime to try, or when they're really stressed, to try and help reduce their stress, to help them fall asleep. The reality is you're not getting the practice of the meditation by doing it in the heightened times, like when you're putting the most kind of pressure on yourself to get the outcome. So what we actually encourage people to do is to do meditation during the day. So if you're having trouble at night and your brain just won't turn off, I'll have people spend 5 minutes even just doing a meditation, whether it's looking out the window, using the apps, whatever it is. And then it's all about not focusing the whole time. Like a lot of people say, I'm not good at meditation. You're not, there's no such thing as being good. It's when your mind wanders, it's just getting back on track. And every time it wanders and you get back on track, you're strengthening your brain to be able to get back on track. So that at times when you're feeling high stress, when you're having a busy brain, when you're feeling really anxious at night, during the day, whatever, if you've put in the time, a month, 6 weeks of daily meditation practice, I'm talking like 5 minutes. People make it out to be a huge thing. It does not need to be. If you do it during the day, you get better at being able to let go of the busy thoughts and the anxiety and the stress that's going on in those moments because you put in that you're stronger for having done it during the day. So meditation's a really big one that I love to do. And then the other thing I really love to do a lot with people is worry time. So worry time, it's so simplistic in the way it sounds, but it's been around since the 70s, and it's a really, really useful technique for people who tend to just have a lot of like a busy brain. They're stressed about a lot of stuff. They're worried about a lot of things. And it's where you spend at night. It doesn't have to be at night, but during the day, whenever you want, you find 20 minutes and you sit down and you write the heck out of everything that's on your brain. Write it all out. And then once the 20 minutes are done, outside those 20 minutes for the next rest of the day, at night, during the morning, until the 20 minutes come again for the next day, if you start thinking about these worries, this busy brain kind of stuff, you say to yourself, not now during worry time, not
Mm.
now during worry time. That's hard to do. But
Mm.
the more you get better at saying not now during worry time and you actually practice worry time, it's almost like your brain doesn't keep saying, think about me, because you're allowing a focused practice of thinking about it. And you don't need to solve the issue because a lot of times we're worrying about things that we cannot solve. So it's about writing it down, getting it out of your brain, seeing it for what it is, and then not now during worry time, the other times. And it's a really effective tool. It's just people don't spend the 20 minutes to sit and do it every single day.
Yeah, but if it can improve their quality of life and their sleep and their mental well-being, like what
Yeah,
a easy
I know.
investment, right? I think it's just having this tool is really, really impactful. You know, I've heard about this with grief, that people
Mhm.
have like days that they grieve when
Yep.
something's happened, and then days when they get up and they go to work and they feed the dog and they are have functioning, but they allow themselves time to grieve. So I love the fact that you actually allow your brain time to be worried.
Yeah, you have
It's,
to.
right.
So often people are just saying themselves, don't think about it. Stop thinking about
Right.
this. And it's all, I always say it's like the whack-a-mole game at like a carnival that keeps popping up. So you keep hitting it down, and then what happens? They keep popping up faster. So instead, you just let them all come out. Let them all come out for 20 minutes, and you get better at just being able to manage it. And if you can do worry time plus a little bit of meditation every single day, that, in my opinion, is like one of the best things for helping the brain in general. For anybody who's dealing with a lot of anxiety, stress, whatever it is, busy brain, it really is such a great technique. They're both great techniques that go hand in hand.
Well, and what I like about both the techniques too that you brought up that I always teach is that it's the daytime habits that set you
Mm-hmm.
up to sleep well at night. It's not like you said, yes, the sleep hygiene stuff is important, but if you're not having good daytime habits, and I would actually even layer in some sort of exercise in there too during the day or like morning sunlight, but
Oh
it's
yeah.
like, yeah, but it's like these are just core daytime habits that to be a healthy, happy, high functioning human being in our current heightened stress society, like you said, adopting these two skills are really,
Mhm.
really important. So I really, really like this so much. Yeah, thank you.
Right. You're
Um,
welcome.
So let's talk a little bit more about mindfulness and meditation. Do you feel that breath work fits within this category as well? Or do you like just, sit down 10 minutes, 5 minutes, like you said, and just do a meditation on your phone or whatever?
I don't think there's any one method in
Okay.
particular. If you do breath work and you want to make the mindfulness exercise, like if you're just doing, let's just say you're doing deep breathing, right?
Mhm.
4-7-8 breathing, or just like even inhale, exhale, relax.
Sure.
If you want to make that the thing that you're focusing on, you can turn that into a meditation or a mindfulness exercise. Mindfulness is just being in the moment, and when your mind wanders, bringing it back. So if you're doing breath work and you want to make it into an exercise, the added layer is when I'm doing my deep breathing, when my mind wanders to thinking, how is this going to help me? Did I pick up the dry cleaning? Whatever it is you're thinking about. Nope, not now. Back on the inhale, exhale, or however it is you're doing it. That's where you can add in that extra level. I always encourage people when it comes to any sort of breath work, start with just doing the breath work first, or like muscle relaxation exercises. So you get the basics of how to do it down. And then when you add in a meditation practice or a mindfulness practice on top of it, that is like, I think of like that, like second level. So then you can practice, but really getting the feel of the deep breathing down first, I think is helpful.
Okay, great. Now, what about in the middle of the night? Like you kind of touched on, kind of that busy brain, waking up. I know a lot of women, especially if they're transitioning through perimenopause and menopause, have that, 3, 4 a.m. wake up where they're just laying there. It's so frustrating. And then when you're awake, your brain's on. So what do you have to say for, developing resilience during that time of life?
Well, I think if that's something that's happening routinely for you, I think you need to think about first and foremost, like what is the window that you have for your sleep wake schedule? So like that's where CBT for insomnia is actually really useful. So a lot of times these women that I'll work with, if they're in bed 8 hours, but they're only sleeping 6.5 because they're up for an hour and a half in the middle of the night, sometimes, and I encourage them, whoever wants to try this, to work with someone or to read like my book or something where it really goes into detail about how to do it and to track your sleep so you get a good estimate of what to do. But if you actually limit the time in bed, which goes, like I said, goes against what we would normally do, that helps people actually, if they wake up, fall back asleep a lot faster. So it almost overrides what the brain would naturally go to as the initial kind of fallback, right? Like I'm just going to be awake. It's almost like a mismatch between the amount of sleep that your body's willing to give you and the amount of time you're in bed. So it's not a super easy thing to fix, but if you can limit the time in bed consistently, that often works really well. And then you work on increasing the time that you're allowed to be in bed. So if it's 6.5 hours, then it'll become 6 3/4 and 7 once you start doing better. And that's, like I said, working with someone or the apps or my book, like those are all things that can be really helpful. And then other things, like some people will just automatically say, like, there's a bunch of reasons why people can wake up in the middle of the night. Some people will automatically say, like, I always, without fail, wake up at 3 in the morning every night. Sometimes it's normal to say to someone, or it's good to say to someone, like, it's normal to wake up throughout the night. We all wake up 4 to 6, 4 to 7 times a night. Everyone does after you complete certain cycles of sleep, a full sleep cycle. And sometimes people have trained themselves to look at the clock and say, oh, here we go again. And that habit in and of itself then makes them more frustrated, try to force sleep to happen. So if you almost come at it with a different feeling of, okay, this is what normally happens. It's around the same time every night because I've probably finished a certain amount of sleep cycles, that let me just lean into it as opposed to getting that tense feeling. So
Mm.
that's another thing that people can do. And then it's also about what are you doing when you wake up, right? So if you wake up and then you go automatically on your phone, or I have so many people who do work in the middle of the night, or they're like, I'm up anyways, I might as well work out even. Like those are the things you're training yourself to do that you really need to work on doing something else. So if you're up and your brain is just on fire and you want to go on a screen, just go sit somewhere else. Do something quiet, calm, relaxing to pass the time. It's not about like finding a boring book or something, because that's just going to make you more resentful and not want to get up and sit outside. So it's about finding something to pass the time where it just is mildly enjoyable. You're not sitting there in the dark staring. And then once you get sleepy again, you go back to sleep. But you want to be consistent with that wake time and try not to nap if you have trouble with sleep, because those are all things that can worsen this problem. So there's a bunch of different things. And the other thing I always tell people is like, if you routinely have awakenings at night and you're feeling, then maybe you snore or have pauses in your breathing, or especially with women, it gets missed all the time. especially when you hit perimenopause, sleep apnea rates are the same as men. So
Right.
it gets missed all the time, and you should really talk with a doctor about it. And they say, oh, you're thin and you're young, you can't have it. Then see someone who might take you a little more seriously, because a lot of times it gets misdiagnosed as insomnia. You can have both, but sleep apnea can often be a reason why people are waking up and have they don't realize that that's why.
Yeah, yeah. I see a lot of women that have sleep apnea that don't realize it. And I agree with you. It's misdiagnosed all the time. So as women,
Mhm.
it's important that we understand so we can advocate for ourselves within the system to make sure we get the testing that we need. Okay, well, I think that's really helpful. I think those are some of the biggest issues when it
Yeah.
comes to stress and sleep and hormone changes. And I love that you touched on the tools that women can use or that anybody could use, right? You
Anyone.
know, between meditation and mindfulness and having worry time. Is there anything else any other tools that you give your clients that you can
I mean,
share?
I think if we're talking about women in general, I think, there's really not, it's not even in men too, but it's not one size fits all. So if you're going through perimenopause or menopause, talking with someone who's knowledgeable, right? So for some people, it could be menopause hormone therapy, right? It could be something like that. For other people, it's CBT. CBT actually there was the recent North American Menopause Society conference. CBT for insomnia actually had better outcomes than hormones. And despite everyone talking about hormones, right? So hormones is definitely one option. CBT is an option. Looking at like sleep apnea medication, there's not one size fits all. And I always tell people, like, don't suffer just
Mm.
because someone says like, oh, that's normal as you get older. Don't suffer. But I really can't stress enough, like, really working on just then there's the basic sleep hygiene stuff, right? Like making sure you're consistent, getting light exposure during the day, making sure you have some movement, right? A lot of people will almost over exercise sometimes though, which is problematic too. It's really just about movement, getting your heart rate up, keeping your bedroom cool at night. Like those are all basic things. And then making sure during the day that you're managing stress during the day, because if you don't deal with these things during the day, guess what? When it's quiet at night, these are all the things that are going to pop up. So making sure that you're taking some time, some breaks during the day. Do you eat your lunch in front of your computer at all every single day? Do you actually get a break? Do you get to walk around? Do you have nonstop meetings? Like think about those things where you can have little moments of decompression during the day, because it's really important, because that will help to kind of keep the steam from rising so much. If you can kind of get little valves to let it out throughout the day, it's very helpful.
Amazing advice. Thank you, Dr. Harris. Okay, so where can people connect with you, find your book, follow you on social media?
Yeah,
Where
so I do a lot on Instagram at SleepDocShelby, and every Wednesday I do a Ask Me Anything. So I can't answer specific personal questions, but I usually will get people hopefully in the right direction or answer more general questions. And I do a lot of debunking of like sleep myths on there. And then you can get my book, The Women's Guide to Overcoming Insomnia. You can get that on Amazon, Barnes and Noble, anywhere that you get books online. And then I have a website, drshelbyharris.com, drshelbyharris.com. And I do a lot of stuff online and TV, so you might see me around at those places as well.
amazing. Thank you so much for spending today with me. I really appreciate it.
It was my pleasure.